So in part 5 we're going to have a brief look at drugs used to fight fungal infections, and again, as per usual, we're not going to go into every antifungal known to man, but we're going to look at the leading antifungals and we're going to deal with them in the order in which they are most commonly used. So the ones that we'll deal with first are the ones that probably at the moment are most useful, going down like we did with the antibacterials to the ones that I deal with later on are those that you would only resort to if the more commonly used ones can't be used for some reason. So the world of fungi is enormous. There's a whole kingdom of fungi, whereas once fungi were classified as part of the plant kingdom, they're now put in a kingdom of their own. And there's a whole range, as you can see, there are just a few of them. There's a whole range of groups of fungi and types of fungi with various different forms and appearances. And of course our job is not to become mycologists or study fungi in great detail, but as with the bacteria, there are many fungi, but not many of them actually cause a problem for us. Not many of them are disease causing. So there's about 1 million fungal species identified, and it's estimated that there are a lot more that are yet to be identified, but only a small proportion of those we actually know can invade and cause infection in or on humans. The estimates range from only 20 fungal species will do it to around about 100, so it depends whose word you take. But of the fungi that are around and inhabiting the planet, very few of them actually cause a problem for us. Now, most of the time for fungal infections, the fungi only really infect our outer surface or just below our outer surface. So they're usually superficial infections, but they can invade systemically. They can actually get into the blood and spread to internal organs, but that usually will only occur if our immune system is severely compromised. So often if you see systemic infection with fungal pathogens, it is because there is very little functioning immune response in the person, or they have been taking broad spectrum antimicrobial drugs which have knocked out all of the normal flora which would normally compete and keep those fungi in check. So you wouldn't expect to see in a normal functioning human a systemic fungal infection. But that's not to say that we don't need antifungals. In fact, our need for them is increasing because we now have, particularly with HIV at epidemic proportions worldwide, we do have a lot of people who do have compromised immune function, and we also still have the superficial fungal infections that need treating. Okay. So fungal infections, also known as mycoses, for us normally superficial, as you can see there. So by superficial, affecting our outer covering, so the skin, hair and nails, and those would be things like athlete's foot, ringworm and thrush or candida. So those are relatively common, tend to occur in little moist nooks and crannies of the body in particular, where the fungus is able to thrive, and those are the ones that we normally find ourselves needing to treat. In tropical countries, though, there is more of a problem with fungal infections because the conditions for them to thrive are ideal really in the tropics, and so subcutaneous fungal infections are far more common in the tropics than they would be here. And there are a number of quite unpleasant ones. What happens for a subcutaneous infection is usually the fungus is introduced under the skin through a cut or some other injury, which is why the feet and lower legs are quite commonly affected, and the fungus gets in and forms abscesses under the skin, which can become quite disfiguring for the sufferer. I have a couple of pictures here, but I want to give you a warning about them because they are quite unpleasant and they're not on your slide. So anyone who's of a nervous disposition, I'm just going to flick up some nasty pictures. So here's an example of disfiguration that comes from a subcutaneous fungal infection of some kind. The abscesses are causing outgrowth and disfiguring, and there's a really quite upsetting one coming up now. Warning. This is a rare fungal infection which causes disfiguration of the face, as you can see there. So the poor sufferer takes on a really quite an alien look, and usually they become outcasts because, you know, as humans we don't deal very well with people who have grossly abnormal faces. We seem to rely very heavily on a relatively normal face in order to be able to relate to people. So these poor people often get cut off from their communities. But those are both examples of fungal infections and the havoc that they can wreak if they actually get under the skin. The systemic infections, that is when a fungus has managed to become bloodborne and can infect other internal organs, these would usually be the ones that you wouldn't expect to see unless there's some problem with the immune response, or possibly if somebody has been treated with broad-spectrum antimicrobials which has knocked out all their other flora which would normally compete, and so you get an overgrowth. Often the entry portal for the fungus in the first place will be the lungs, and then not meeting any resistance from anybody, it can find its way into the blood. And finally there's allergic mycoses, which are also classified as a fungal infection. In this case the problem is produced by an allergy to the fungal spores, and it usually occurs in people who have a tendency for allergy and a tendency particularly for hypersensitivity around the respiratory system, or a compromised respiratory system such as cystic fibrosis sufferers. So what you're seeing here is not so much the pathogenicity of the fungus but the allergenicity of the fungus, so the response is an allergic one, but it's still a problem. So those are the kinds of diseases that we can suffer from as a result of fungal infections. I'm just showing you a couple of the ones that are more common probably in our parts of the world. Thrush candidiasis, infection by the yeast Candida. You can see when there is candidiasis because there's this classic kind of creamy curds deposit in the mouth if it's oral thrush, or wherever else the fungus has taken hold. Like many funguses, it tends to like warm, dark, moist places, so those are the kinds of places on your body that it is going to thrive if it can. We've talked about oral thrush occurring for people who have to use steroids, for example asthma sufferers who use inhaled steroids, so you're constantly getting steroid deposition in the mouth, which would of course compromise the immune response in the mouth because of that local application of a steroid, and oral thrush can be a problem unless you're careful to wash the steroid out of your mouth whenever you use the inhaler. This example here is the candida between the fingers, so it can set up in a lot of different places. And the other one I wanted to show you an example of is aspergillosis, sometimes known as farmer's lung. This is a fungal infection. Now it can be responsible for two of these things. It can be responsible for sometimes a systemic fungal infection, or it can also be responsible for allergic mycoses, so that's why I'm showing you this. This diagram is showing you that the spores can actually be inhaled, and if you are hypersensitive to them you can get an allergic mycosis as a result of inhaling the aspergillosis spores. And these are around in the environment, in the soil, amongst vegetation generally, so once you are allergic to it then you have a bit of a problem. But in addition to that, the fungal spores of course can invade and set up an infection, which can, again much more likely in someone who has a compromised immune system, get into the blood and spread to other organs. This same fungus can set up what are known as aspergillomas. In other words, it can form itself into abscesses within the lung that are filled with the fungus. It causes an abscess that remains potentially infectious with scarring and so on. This picture here is of the other possible areas that aspergillosis, if it does become systemic, can affect. So it can settle in the orbits and cause horrendous deformation around the eye. It can get to the brain, and it can cause skin lesions like you can see there. So those are two examples of fungi that can cause a problem